Hi, I'm Helen Buhaenko. I'm the manager of the Deg Foundation Group in Merthyr Tydfil. Currently, we support 800 people weekly with welfare and food support during the pandemic. We've been delivering anti-poverty and wellbeing services to residents across Merthyr Tydfil for the last 20 years. We're well established across the borough. This pandemic has been exceptionally traumatic for our communities. It's the isolation, the loss of income, the ill health, restricted lives, the impact on the young people, their education and social development. So how are we going to get beyond this anxiety, tension, monotony, and general sense of hopelessness that everyone is feeling? Well, we feel that there are some unexpected positives to be taken from the lockdown period over this last year. One of those is the strong sense of community, which you want to keep for the future. We've pulled together, and many people have volunteered through their furlough and their unemployment. And there's a real sense of connectivity and an increased value for volunteering. Also, during this time, there's been an appreciation of nature and the natural environment, and a real valuing of how nature can really enhance your well-being. We want to keep that. Also, society in general is really beginning to value and respect the grounded, vital services that people deliver, and that's really important. So people have the sense of pride in their roles and their jobs, in their healthcare, retail, transport, communication roles that they serve the community with. And also, we've learned that change is possible and change comes fast, and we want to really hold on to that sense of change and change for the better. So what does a strong community look like? So on the other side of this, we want a community which is full of hope and full of possibility, and where it's positive, connected, engaged, learning, creative, where people are in good mental and physical health, and they're kind and they're inclusive. So what to be done about this? How? Well, first of all, from our perspective, even though we're a holistic organisation, we really are concerned above all now for young people who've carried such a burden during this time. So our youth deserve a fast track back to a full life again. They deserve fun. They deserve the chance to socialise and meet, be creative, catch up on their education. And those 16s up, they need a chance to train and get into the workforce. So we really feel that as a third sector community organisation, we're very good at psychosocial connectivity and change. We have strong connections with local residents and are able to engage, support, encourage, disseminate. But as a sector, we really need to have the support of structural change in tandem with us to be able to create this holistic change. So we can support young people, but we need the jobs, we need the apprenticeships, we need the grants to start up businesses for those young people to be able to get into employment. And they need that chance and positivity. And then others in the community will also need to retrain now. And we can help them with skills development, but there needs to be more jobs in new sectors for the future, like green energy, so that they can actually then have future economically sustainable careers as well. As well as economic support, also there needs to be a real focus on health inequalities. So a really strong community would also have excellent physical and mental health, as well as dealing with the backlog with appointments and dentistry and opticians appointments that we're seeing. Also, a society, a community where people are able to come together, to have communal activities, so that they're connected, where they can have exercise opportunities, where we can recalibrate eating habits, where there's positivity and well-being to be found from substances beyond substance misuse, alcohol, drugs, and prescription drugs. So a society where we can really come together and enjoy well-being together and care for each other and for the planet. So this strong community, as well as having as well as having lots of interventions to support the financial and economic rebooting, this strong community will also really focus on health and well-being. So as well as dealing with all of the backlog of appointments in dentistry and in optician services and in operations and primary and secondary healthcare, also there will be a lot of well-being activities that people can be engaged in through exercising, volunteering, coming together, eating together, dancing together, singing together, and that whole sense of well-being, connectivity and socializing that really underpins general physical and mental health. So our sector can do all of that, and we can also play a really important role in the change that's happening in society today. Third sector, particularly the community sector, is so connected with local people. We understand what's happening right now, and we can be a channel for change and really ensure that policies and strategies for the future are really impactful and directed at the needs of people.